Please welcome Kathryn, Marxen, Simonson.
So welcome to our session on the impacts of vision loss on family dynamics, tools and tips for success. Thank you, Dr. Boyer, for a wonderful introduction. As he said, my name is Kathryn Marxen Simonson, and I'm an occupational therapist in the Low Vision Rehabilitation Center at KCI Institute. I am also a certified low vision therapist. And I'm also an individual with a vision loss myself. I was born premature and developed retinopathy of prematurity, ROP, as we call it for short. And it's a common eye disorder among premature babies. So through my life, I have had vision challenges. And through learning to cope and adapt with these challenges, has led me to pursue my career as an occupational therapist specializing in low vision rehabilitation. I'd also be remiss to not introduce my wonderful guide dog, Nabisco. He has done wonders to enhance my mobility and my independence. As an introduction, vision loss has far-reaching impacts on the individual who is diagnosed, their family, friends, and caregivers. Today, we're going to explore what vision loss impacts to the individual and the impacts to the family and friends. And we are also going to explore tips and tools and strategies to maximize the success between these relationships. So let's first take a look at the vision loss and its impact on the individual. Vision loss has a significant impact on the individual. It affects their activities of daily living, their independence, impacts their mental health, and there's also impacts on any additional medical conditions that an individual may have. So we're going to explore these areas in a little bit more depth. Vision loss has a significant impact on all activities of daily living, whether this is self-care, home management, shopping, reading and writing, leisure activities, social activities, and financial management, just to name a few categories. Some things that might be difficult include completing your grooming activities and grooming routine, cooking and cleaning in your home, reading labels and price tags in the grocery store, or reading books for leisure and pleasure. Vision loss also has a significant impact on one's independence. This can be through their personal mobility. Often individuals with vision loss show a slower walking speed, have difficulty going up or down stairs, and are at a much increased risk of fall, which could lead to hip or arm fractures. Vision loss also has a significant impact on one's independence in terms of transportation, as often you lose your ability to drive. And you may be left with questions of how will I get around? There are several options that are available, and these include relying on family and friends, taking public transportation, paratransit, and luckily in Portland we have great public transportation with the TriMet and Lyft services, taking cabs and taxis, or rideshare services like Uber and Lyft. Vision loss can have a significant impact on an individual's employment. The National Federation for the Blind estimates that as of 2016, 70% of adults aged 21 to 64 are not employed in full-time work. But although vision loss can have a significant impact on employment, this should not stop you from maintaining your employment or seeking employment. Through the Americans with Disabilities Act, you are able to receive the accommodations and modifications you need to maintain your job and complete your work. Vision loss also has a significant impact on education. Only 15.3% of individuals aged 21 to 64 years of age have earned a bachelor's degree. And just as employment, individuals can receive support through the Americans with Disabilities Act to achieve their educational goals. We're going to examine the impact of vision loss through a mental health lens. Oftentimes, individuals, when they receive an initial diagnosis of a vision condition, they may experience a variety of different reactions. And this may be because they're told that the medications and that glasses are not enough to correct your vision fully. And some of these reactions may be shock, denial, anger, depression, or even acceptance. An example of denial is when an individual may continue to participate in daily activities, even with extreme difficulty. An example of anger may be when an individual displaces their feelings of anger towards family and friends, or have exaggerated reactions. It can be associated also with the stages of grief, and those are common as shock, denial, mourning withdrawal, succumbing depression, reassessment and reaffirmation, coping and mobilization, and self-acceptance and self-esteem. Also, from that mental health perspective, an individual may have many fears and concerns related to the prognosis of their vision condition. Will I go completely blind? They will have fears about the impact on their daily activities, as we discussed a minute ago. How will I complete my daily activities and chores? Will I be able to keep driving? It can have impacts on and concerns and fears about the perception of others. How will others react to me when I tell them that I have a visual impairment? What will they think of me when they see me with a magnifier or a white cane? There's economic fears and concerns. Will I have the ability to continue to work? What about the cost of doctor's appointments and therapy visits? What about the cost of low vision equipment? How will I pay for the tools that I need? Concerns about the impact on family and friends. Will I be a burden to my family and friends? How will my family and friends understand what I'm going through? And finally, uncertainty about the future. Will I be able to continue to live in my home? Oftentimes, individuals must create a new identity of who this person is with a visual impairment, and who will they become. And you are able to continue to do all the things that you used to be able to do. You just might have to learn a new way of doing them. Vision loss can also have a significant impact on other medical conditions. Some of these other conditions include hearing loss, hypertension, heart disease, diabetes, and arthritis, just to name a few. Vision loss also has an impact on the management of these other conditions. For example, self-care with diabetic foot management and care or wound care, medication management, transportation to and from appointments, or attending appointments. On the flip side, these other conditions also may impact your ability to manage and cope with your vision loss. For example, let's think about for a minute if you have arthritis in your hands and decreased range of motion in your shoulders and your arms. This may have a significant impact on your ability to give your necessary eye drops or other medications. And other conditions can also have an impact on the success of vision rehabilitation. Medical conditions can cause fluctuating health status, can cause communication barriers, such as hearing loss or cognitive impairment. Individuals may feel overwhelmed by competing healthcare demands. And unexpected health events such as falls or hospitalizations may delay the progression of vision rehabilitation. But don't let this scare you or stop you. A well-trained optometrist and occupational therapist can assist you with managing your vision loss and your other medical conditions. So now we're going to look on the other side of the coin and examine how vision loss may impact family, friends, and caregivers. Just as the individual who received the diagnosis may have strong feelings upon receiving that diagnosis, the family members and friends may have a similar reaction. They may feel fear, shock, denial, anger, or depression or acceptance. And they may also experience the stages of grief. Family members also experience concerns for safety for their loved one. They may misunderstand the functional impacts of the vision loss and underestimate the abilities of their loved one with a vision condition. This could lead to overprotection, and overprotection is associated with poorer adjustment to low vision, more depressive symptoms, and decreased mastery of the environment or their new skills as a visually impaired person. Vision loss may also have a significant impact on the spousal relationship. The individuals may feel as though they are a burden to their spouse, always relying on them for assistance, transportation, and help. And the family member, this may lead to feelings of resentment for both individuals in the relationship. Support. Family and friends want to help. Family and friends want to provide support to the individual. And the individual often relies on that support to complete their daily activities, to get to appointments. And when we look at support, there's two different types of support: instrumental support and emotional support. Some examples of instrumental support, which are those tangible things that someone does for you, is taking you to doctor's appointments or rehabilitation appointments, assisting with chores around the house, running errands, assisting with activities of daily living, assistance with adherence to rehabilitation goals and directives, financial management, and reading those labels that you just can't see. Some examples of emotional support include positive affirmations, providing a listening ear, and encouragement. The level of support that your family and friends may provide may significantly increase if the individual also has other medical conditions. And family members and caregivers who provide the support are also at risk of negatively of neglecting their own needs, leisure pursuits, and personal and family interests. So now we're going to talk about some tips and tricks for adjusting, because those are a lot of impacts. And vision loss, as you know, impacts a lot of different areas of your life and your family and friends. Adjustment tip number 1. Take a minute to stop and look around the room. Each and every person in this room is either affected by vision loss or knows a family member who is. You are not alone. Adjustment tip number 2. You can lead an independent life. As we'll hear in a moment from Dr. Boyer, vision rehabilitation can be the key to increasing your independence and living your life more fully as an individual with vision loss. Your rehabilitation professionals can help you develop tools, tips, and strategies and teach you how to be more independent. Some examples include home modifications, use of a magnifier, or orientation and mobility services to be able to walk more independently. Adjustment tip number 3. Learn as much as you can about you and your loved one's vision condition. We got a great introduction to that this morning with the talks on macular degeneration. Ask questions of your medical providers. Read. Talk with others who experience the same condition. Learn as much as you can to calm your fears and concerns about the future, and to better understand what is happening and why. And then share that. Share that with your friends and your family members so that you all can come to a mutual understanding. Adjustment tip number 4, communicate. Talk with your family and friends about what you were able to see, what things that you are able to do independently, and what things that you may need help with in your goals. We'll take a minute to talk about a few tips for good communication. Keep the lines of communication open. Say what you want to say with sensitivity. Overcome your fear of discussing difficult topics. Broaching the difficult topics can lead to positive and open communication. Prepare what you are going to say ahead of time. Thinking through what your feelings and what you want to say and what you want the outcome to be can lead to better outcomes through thoughtful communication. Break the ice. Bring up new ideas incrementally. Don't overwhelm both of you guys. Be direct. Even though it may be uncomfortable, being direct is often the better way. Be sensitive. Be sensitive to the other's feelings. Think about your tone of voice. Often, how you say something is just as important as what you say. Give your full attention. Stay focused on the conversation and don't multitask. Express your feelings. Both parties need to express what they are feeling about the situation. Be supportive. Express your feelings and willingness to be supportive and help your relative with the vision loss, but also be direct about your needs. If too emotional, postpone the conversation. None of us have productive conversations when we are feeling particularly upset or emotional. Wait until you've both calmed down to have the conversation. And finally, promote understanding. When finished with a conversation, do a check-in to see that you both understood what was talked about. Adjustment tip number 5, accept and give family support. Support is critical to the success of an individual's adjustment to vision loss. We can give those instrumental support or that emotional support. Support from family members is associated with better adjustment to vision loss, greater life satisfaction, and fewer depressive symptoms. Discuss with your family and the individual about balancing support. Individuals need independence to be able to learn the tools and tips and strategies that they are learning as an individual with vision loss. And family members need to know how much support they need to provide as to not be too overprotective. What type of support do you need? How much and when? Adjustment tip number 6, be active participants in vision rehabilitation. Be honest and open about your feelings, experiences, adaptations, and coping. It is only through your honesty that your providers will truly be able to help you achieve your goals and provide you with the right tools and strategies. Adjustment tip number 7, seek mental health services if you need to. If you and your family members are having a particularly hard time adjusting, or you're having a hard time coping with your vision loss, there's nothing wrong with seeking out a mental health provider to formally help you through the process of adjustment. They will be able to provide counseling and strategies to help you through this major life change. And finally, adjustment tip number 8, engage in social and recreational activities. Try to normalize your life as much as possible. Engage in all the activities that you used to do to the best of your ability, and learning new tips and strategies to be able to do that. Or consider trying something new, like dragon boating, goal ball, or adaptive cycling. And I think we'll get to hear more about recreational activities later this afternoon. So in conclusion, low vision has significant impacts on the individual as well as their family members and caregivers. But there's opportunities to develop an understanding of these impacts, to have deep conversations and communicate with your family and friends about these challenges and the help that you may or may not need. And family can provide positive support to help you through this process. And engage in rehabilitation, social, and recreational activities.